The school-based health center is located in the elementary, middle, and high schools, and it's a health facility that the students can use to see the nurse practitioner, a mental health clinician, or a dietitian during the school day. For ease of use for the students and for their families. A lot of families may have trouble with transportation or being able to take off work to take their student to a doctor's appointment. So if a student is not feeling well, they can go down and get an appointment right then to see their nurse practitioner. If a student's having a rough day, feeling stressed or anxious, they can go down and see the mental health clinician right away. So it's ease of use being right in the school. The student or the parent can just come to the school-based health center and get a registration packet, fill it out, and turn it back into the school or to your school-based health center, and then your student is a registered member and can use all of our services. We don't charge anyone for our visits. You don't have to have insurance. If you do have insurance, we will use your insurance, but you will never have a copay, get a bill, or have to pay anything for our services. It's free to everyone. In the middle and high schools, we have a nurse practitioner, a licensed mental health clinician, as well as a dietitian. The nurse practitioner can see students for sick visits, they can do sports physicals, they can do regular well visits, vaccinations, flu shots. Different high schools also offer birth control. We also do crisis visits with students who are having difficult time. They can drop in and see a mental health clinician and talk to them. We also do suicide prevention and risk. The school-based health centers collaborate with the school nurse. Students will often go to the nurse first, and the nurse will refer them to the school-based health centers to the nurse practitioner. The nurse practitioner does things very similar to a primary care physician, such as diagnosing, and also can prescribe medication for the students. For certain services, we do suggest an appointment such as a sports physical, getting an immunization. Students who come for weekly counseling, having an appointment is very helpful. But there are certain services they don't need an appointment for. If you're sick, you can come, we'll fit you in the schedule. And the parent doesn't have to be there. That's another ease of use of the center. Our services at the school-based health center are confidential. We let students know that, as well as families. There are certain instances of things that can't be confidential, such as if a student was suicidal or homicidal, or if abuse was going on at home. And we explain to the students that's to keep them safe. As a provider and a parent, the school-based health center has been helpful for my family. My son wasn't feeling well and went down to the school-based health center. I also have an 8th grader who will be going into high school next year and will have his sports physical done there.